Welcome to the LowCarbMD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the Low Carb MD podcast. Trobe, gosh, man, we don't get too many heroes on here. Like seriously, people who've done some great stuff.
Look, I'm so happy to be here, Brian, today. And we have an esteemed professor with us, Dr. Peter Bruckner. I'm sure many of our listeners have seen his presentations from Low Carb Down Under and other presentations he's made. He has a CV about a mile long, but bottom line, he's a physician with a specialty in sports and exercise. And he also has the website, I believe it's Defeating Diabetes. Is that right, Dr. Bruckner?
Defeat Diabetes.
Defeat Diabetes. Yeah. And let me tell you, he works with this guy. I don't know if you've heard of him, Brian. His name is Paul Mason. And apparently somebody in Australia was able to tame a younger, more energetic doctor. So anyway, that's something that's a little inside joke for everybody between me and Brian. But Dr. Bruckner, we're very happy to have you here. We're excited about all the work you've done. Your lectures have inspired me. And we're very, very honored to have you here.
Oh, it's my pleasure, guys. It's nice and early in the morning in Melbourne, Australia. But thanks for fitting me into your schedule. That's great.
No, it's so great to have you here. It's an absolute honor. We love everything you're doing. It's been so exciting. And seeing you and Paul Mason together, that's like a dream team.
Yeah, he's an interesting character, Paul. He's probably about the smartest guy I've ever met, I think. But my role is to sort of harness his genius, I think.
Yeah, I know how that is. I know a guy like that too. But I think Paul doesn't cuss as much as other people that we might be referring to. Yeah, that we have to rein in a little bit, huh, Tro?
Clearly, he's got more hair too. I think that's the other side of it. Listen, Dr. Bruckner. So help me understand, how does a world-renowned kind of sports medicine physician, how does he get around to saying lower your carbohydrates? Like, don't you need Gatorade and cornflakes and Wheaties? So help me understand, where does this origin story start? We saw it with Tim Noakes, we see it with Paul Mason. But I want to hear about your origin story. It seems like the sports medicine doctors are basically changing. So tell me, how did that happen? Because we grew up with Wheaties and Gatorade.
Yeah, well, so did I, and I pushed that for 30 years, the first 30 years of my career, shamefully. But so as you said, I've been involved in sports medicine all my career. Run a clinic here in Melbourne, Australia, multidisciplinary sort of clinic with doctors and therapists and podiatrists and all sorts of people. And been involved with a number of different sporting teams, both here in Australia and internationally. And it was when I was in the UK working with the Liverpool Football Club, one of the big Premier League teams over there. I spent 3 years in the UK. And so it must have been, 2012, 10 years ago now. And I was living in Liverpool. And if you'd asked me then, how was I, how's my health? I'd have said, yeah, I'm good. The reality was I wasn't quite as good as I thought I was. So for a start, I just turned 60. I'd have a family history of type 2 diabetes. So my father had developed type 2 diabetes at exactly that age. So I was pretty aware I didn't want to go down that track. I'd seen what had happened to him. And I was overweight, borderline obese. I'd probably, like many middle-aged men, and I considered 60 middle-aged. I used to think it was old, but now I think it's middle-aged. Like many people of that age, I'd probably put on, a pound a year for the last, 30 years. And I'm probably, 30 pounds overweight at this stage. And I had a whole bunch of metabolic abnormalities. I'd had had a high insulin level, high triglyceride level, and I'd had a fatty liver for 10 years. Every couple of years you have a blood test, comes back, liver function test consistent with the fatty liver. Like a typical doctor, I'd completely ignored that, and I didn't really understand what a fatty liver was, and I figured I was on a low-fat diet, so everything would be fine. So, basically I was, in retrospect, I was clearly pre-diabetic, though I didn't realize it at the time. So I'd always been a bit interested in nutrition. Way back in the sort of 1980s, I'd co-authored a textbook on sports nutrition and so on. But to be honest, sports nutrition and nutrition in general had got pretty boring. It was just carbs, and Gatorade and Powerade and that sort of stuff. And so I'd sort of lost a bit of interest really in nutrition. So anyway, getting back to my story. So 10 years ago, I've had a long-standing friendship with Tim Noakes. So Tim and I both have similar backgrounds, as you mentioned, both sports medicine, sports science. We'd shared platforms at conferences for years, and as usually the token non-Americans at big American conferences, we'd hide in a corner and talk about cricket and rugby and things like that. So we always got on pretty well, and I'd always admired his intellect. He'd challenged a couple of the sort of the givens in sports medicine over the years and copped a lot of flack for it, but it always turned out to be right. So, I had a huge respect for his intellect. So around that time, Tim sort of came out, and came out as someone who'd always been an advocate of carbohydrates as the main fuel for exercise. And he'd had his own experience, as I'm sure you're aware, and had become quite unwell, developed type 2 diabetes, got overweight, hated running. He was a great runner. He'd run lots of marathons and comrades marathons and so on. And he happened to read a book, and one of the Atkins books, and thought that all of a sudden everything clicked into place for him, and he changed his diet. And literally, he says, within a week he felt like a completely new person. He could run again, and he sort of put his type 2 diabetes into remission and so on. So when Tim came out and started talking about that, I thought, oh no, Tim's finally, he's finally lost it. It's he's had some wacky ideas in the past, but this is absolutely crazy. I sort of thought we couldn't have this wrong. Like we couldn't have been going for the last 40 years, the whole Western world on a particular diet, and here's this guy, saying it's wrong. But I guess I had enough respect for Tim's, intellect to think, hang on, I need to look into this. So I bought Gary Taubes' book, Good Calories, Bad Calories. And I guess, that was sort of the book that changed my life, really. I started reading that, and I found it quite disturbing, because as not only does Gary sort of talk about the relative pros and cons of carbs and fats, but he takes you through the politics of how it all happened. And that was the scary bit. I'd always assumed, and I guess most people have, that, that our current sort of low fat diet was based on, good science and lots of research and everything. And here's this guy suggesting that it was based on nothing but, money and politics and ego. And I remember, putting down the book each night thinking, feeling quite disturbed. Because I'd probably, I might have been giving the wrong advice for the last 30 years. And, but just disturbed that, maybe we'd got this wrong. And so I found the book, really, as I said, very disturbing and life-changing, challenging. So then I was hooked. I dived into every single thing that I could get my hands on, every book, every research article, just everything I could get my hands on. And the more I read, the more I thought, I think they're right, these guys, Noakes and Taubes and so on. And again, felt quite disturbed about it. So I thought, well, now I'm a scientist, aren't I? So I need to do some research, of my own. And now, as a scientist, also, we all know that research with an n=1 is a waste of time, except when the one is you, of course. So I decided it was time for an n=1, a highly, dodgy research experiment. So I just picked a date, got all the bloods done that day, and then went on a pretty strict low carb diet. So usual thing, you know, just stopped all sugar, all starches, you know, no more rice, potatoes, bread, cereal, etc., etc. Went back to eating probably the way that my grandparents had eaten, lots of real food, you know, meat, fish, dairy, you know, all that, you know, full fat dairy that we've been told was so terrible for the last 40 years, and eggs, you know, all that cholesterol. Oh my God, you can't have eggs. And lots of veggies, and the only fruit I had was low carb fruit, berries, and nuts and olive oil and all the usual sort of stuff. So I decided I'd do that for 3 months. So weighed myself every week, and as I said, did my bloods on day one, and then I get the end of the 3 months. So to cut a long story short, I had a pretty dramatic effect. I lost 30 pounds in that 3 months. I was never hungry once. So the hunger was interesting. The first thing I noticed was I stopped being hungry. You know, instead of having sort of, you know, 3 meals and 3 snacks a day, you know, always being hungry, you know, I'd sort of have my breakfast at cereal or whatever at 8 o'clock in the morning, and then by 10:30 you'd say, God, it must be lunchtime soon, you know, and have a snack and on always being hungry. So instead of that, I'd have my, you know, eggs and bacon and avocado or whatever for breakfast, and I wasn't hungry all day. So I went from eating 3 meals and 3 snacks a day to eating 2 meals a day. I still eat 2 meals a day to this day. And so hunger was the first thing. Then the weight started to come off. You know, every week I just kept losing weight. I also had a lot more energy. You know, I wasn't falling asleep in the afternoon. I slept better. I stopped snoring. You know, happy wife, happy life. That was a very good popular move. Yeah, just generally had more energy, and my exercise improved. You know, I kept doing the same amount of exercise, but I just felt much better. I felt I could run forever, you know, which I'd never felt before. It always been a struggle before. So yeah, then at the end of that 3 months, I said I lost 30 pounds, 13 kilograms as we call it. I got my bloods done, and basically I'd reversed every single one of my metabolic abnormalities. So my liver function that had been abnormal for 10 years had got back to normal in 3 months, maybe even less than 3 months. I needed the blood test after 3 months. Interestingly, my triglycerides took a while to come down. At the end of the 3 months, they hadn't changed much, and I was really disappointed. I thought, oh no. And then I read a bit more and realized that, you know, maybe I'd just been mobilizing a lot of fats and so on. And then a couple of months later, I did another test, and my triglycerides were down to normal. So, you know, basically, insulin came down. So everything that had been abnormal prior to that, you know, clearly pre-diabetic, had been reversed, and I was no longer pre-diabetic, and I felt fantastic. So, you know, that was I thought that was a pretty good 3 months work, really. And you know, I guess, and obviously I decided to continue on. I wasn't probably going to be quite as strict after that first 3 months. I just backed off a little bit, but you know, by and large, I've stayed on that diet for the last 10 years. And I guess, you know, when you have that sort of experience, as I'm sure you guys have been through, you know, you have sort of one or two choices, really. I mean, you can either just sort of, you know, dive into your little rabbit hole and say, yep, good, I'm right, mate. You know, that you know, I'll look after myself. But I really felt, you know, that I'd you know, discovered something, not that I was the first to discover it by any means, but, you know, I'd come across something, and I needed to tell people about it and tell other people, take other people on this journey. So so that's when I started becoming a bit of a low carb advocate, I guess, and started on my low carb journey. But yeah, sorry, that went on for a long time, didn't it?
No, that's
so,
awesome. That's amazing, because, you know, that's part of what Tro and I are trying to accomplish too, is have other people say, just take a look and see. And then once you try it and you see, and then someone would probably argue, well, I mean, I'm sure a lot of people say, what a coincidence. It happened at the same time he changed his diet. It can't be from that. There so many people try to explain it away, but you were smart enough to look and say, wait, if I trust Dr. Noakes and I trust, you know, Gary Taubes, maybe I'll look into it and have an open mind and think about it. Now, if you had done a 3-month experiment and gained 20 pounds, you go, okay, that doesn't work, right? So we go by our clinical experience and then testing on ourselves, because we don't want to hurt patients, right?
Yeah, that's right. And then, you know, then all of a sudden people started noticing, you know, they said, whoa, well, you know, doc, you look great, you know, what's happened, you know, and so that's an opportunity to tell your story, and more of my friends and colleagues and patients, you know, would, you know, they want to know more about it. And so I thought, well, there's this interest out there. I'll start talking about it and writing about it and giving presentations and things like that. So so I became an advocate. I teamed up with Rod Taylor from Low Carb Down Under and started speaking at his conferences and realized there was this low carb community out there that I was totally unaware of. And it's a great community, both in Australia but internationally as well. And started going to the meetings in Denver and Vail and all those nice places to go and have meetings. Got to meet a whole bunch of people around the world who had similar interests. So it's been a fascinating journey. So I started speaking and so on, and then a lot of people were saying to me that we're just confused. We thought we knew what we were supposed to eat, low fat, and so on, and now we just don't know what we're supposed to do. We're supposed to do paleo, we're supposed to do keto, we had to do Mediterranean, all this sort of stuff. I mean, what's going on? And I'm talking to lots of people, and we all agree that the one thing that everyone agrees on was sugar. So even the dietitians agree on sugar. So we figured, well, let's tackle sugar to start with. And so we started a sort of a not-for-profit charity called Sugar by Half, with the aim of reducing the intake of added sugars in this country by a half. So the average Australian was having about 16, 18 teaspoons of added sugar a day. And as you know, the World Health Organization has recommended an ideal of 6. So we figured, well, let's try and get it down by at least half. So we started that Sugar by Half campaign about 5 years ago and got a great lot of people on board. And we've been active. We've got a program for schools, for school kids, and for corporates, and for sporting clubs, and so on. And then a couple of years ago, I got approached by the publishers, Penguin Random House, the largest publishers in this country, and they said, would I write a book? And my initial reaction was, well, the last thing the world needs is another diet book. I mean, God, there's that many. You go to a bookshop and there's hundreds of diet books. We really didn't need another one. But they convinced me that there were not many by doctors and none by Australian doctors. So they convinced me to write a book. And I've done a lot of writing before. We have the main sort of textbook in sports medicine that's used around the world. So I've always enjoyed writing and done a lot of writing. And interestingly, so I just went away by myself down the coast. We have a little apartment down there, and hid myself away for 3 weeks, and wrote this book in 3 weeks, which clearly it was in my head, and I just had to get it down on paper. And then the challenge was finding a name for the book, and I couldn't. I was asking all my friends, look, I need a name for this book. I couldn't think of a name. All the names I came up with were boring and uninteresting. And then finally, just one day, I just suddenly realised that the obvious name for the book was A Fat Lot of Good. We're talking about the benefits of fats and so on. So the book became A Fat Lot of Good, and it's been a bestseller here in Australia. And it's still selling really well, even 2 years down the track. So that was a great experience, and got a lot of publicity. And I guess it sort of helped in Australia. I've got a bit of a sort of a media profile through my sporting involvement. So I've been able to sort of use that, I guess, to help promote this sort of, these sort of activities that I'm doing now. So the book got a fair bit of publicity. And then I guess, for all of us, really, the elephant in the room, if you like, is type 2 diabetes. And, there's so much misinformation and poor management about type 2 diabetes, the whole, chronic progressive disease sort of thing, nothing you can do about it, just got to learn to live with it, all that sort of stuff. And clearly, there's lots of evidence that that's not the case, and that a low carb approach can be very effective. And I'd noticed in the UK that had a very successful app-based program called diabetes.co.uk. Similarly, in the US, obviously the Verta program had been very successful as a sort of a digital program. So I came up with the idea of trying to do a specifically Australian program to tackle to diabetes. And initially, you spoke to the people in the UK about maybe licensing their program, and that didn't work out. So we so Paul and I decided with Paul Mason, and I contacted Paul and I said, let's do this. And he said, yeah. So we tackled this issue with the help of a dietitian, Nicole Moore. And we've put together an app-based program that we call Defeat Diabetes. The website is defeatdiabetes.com.au. That's an Australian one. And we put together a whole bunch of videos, articles, recipes, meal plans, cooking demonstrations, you name it, everything you needed to have background information about the science, but also the practical aspects of, how you go about a low carb lifestyle to tackle defeat diabetes. So we launched that. It's a paid subscription. It's pretty cheap. It's only a couple of dollars a week to subscribe to this app. And we launched that January 2021, so just over 12 months ago. And we got a reasonable amount of publicity, and we've had pretty good uptake. We've had over 5,000 subscribers so far in our first year, which I think is pretty hopeless. But everyone tells me that's great for the first year of a startup. So, but we're getting more and more publicity. We've just had a great campaign run by many of the regional newspapers here in this country promoting the service. So it's getting more and more interest in it. So I guess that's what I'm spending most of my time on now is working on this Defeat Diabetes program. We are about to embark on a full-scale research program with a PhD through the Trobe University PhD student looking at the outcomes of our program. But in the meantime, we did an initial survey of our original subscribers when it first launched, and we after 3 months we reviewed their cases, and we had over 60% of those put their diabetes into remission. They lost an average of 18 pounds in that 3 months, and reduced their medications and had all the effects that similar programs have had internationally. So it was what we had expected and hoped for, but it was always reassuring to know that our program seemed to work just as well as the other programs around the world. So so we're currently developing a web-based component to it. So at the moment it's just an app. We have a website, a supportive website, but the program is basically on an app called Defeat Diabetes. But our sort of plan for the first half of this year is to develop a web-based program again, because there are certainly in the older generation, I think there are people who are not as comfortable with apps as the younger people are. So we want to have a web-based alternative to that as well. So we're constantly working on things, constantly producing new content. We've just got a great behavioral psychologist on board who's going to produce some lectures on that area. We've just got into a partnership with one of the meal delivery companies here in Australia called Thrive, who put out great low-carb meals. We've also just developed an initial rapid weight loss program. So a 4-week sort of program for people who are impatient, who want to have a dramatic weight loss with the start of their program. So that's sort of a reduced calorie low-carb program for 4 weeks, and then they move on to the standard low-carb program. So there's plenty happening. Keeping Dr. Mason under control is my major challenge, but so far so good.
Man, that's great stuff. Tro, I know you're chomping at the bit. You go for it, man. Then I'll have a question right after you.
No. I mean, it's like, what a sad world we live in. I just went through the pain and agony of doing exactly what you did, which is, I just launched an app, basically creating a community, exactly what you're describing, videos, content, and interaction and social networking to help people along, right? We shouldn't have people in silos, trying to navigate some of these medical and dietary issues alone, and we need to connect these people. I think that's so critical, and what you're doing is amazing work. But what a sad world that doctors need to become app developers, right?
Yeah.
I mean, I never thought to myself, and I'd be interested to hear I guess in one sense, it's like an amazing world that we can reach more people and reach out to people. but this information, it's not there for people in a way that's accessible. And the fact that you went and put an app together, kudos for you, because I know it's not easy. We just went through it. It is hard. And then that web component, we face the same thing. We have that web, we know that some people want to go on the web. And so we added that web component. But again, all of this is why are doctors doing this, right? Why wasn't this done before, And then you really go into that dark place that I think you mentioned about with the politics of how we all got here, right? And what made us ignore kind of nutrition for the past 50 years in medicine, right? And focus maybe on the wrong things. And I think that's what we're fighting against now, right? I mean, essentially.
Yeah.
Curious to hear your thoughts about all that.
Yeah, well, there's a bit to get through. I mean, firstly, the app. Yeah, I mean, I had no idea about apps. I mean, I used apps a bit, WhatsApp and a few of those sort of things, that the kids get me into, sort of thing. But I was very naive about apps, and I'd had a bit of experience with websites, and I thought, oh, that was fairly straightforward. But apps are, as you know, it's very complex, and expensive. I mean, God, we've spent a lot of money on this, but anyway. Yeah, that was an interesting experience. Getting and fascinating. I mean, a learning experience. You're always learning new things. So, but yeah, it is on the one hand, it's a great means of communication. An app. I mean, it's just there. It's on your phone. It's it's so easy. But yeah, there is certainly a lot of, especially the older people in the community are probably not that comfortable with that, and so it would be important to have the website as well. It's been interesting. As Brian would know, I mean, the reaction of the medical community is very interesting. I mean, it's funny how once you sort of understand the issues of carbohydrates and fats and diabetes and so on. I mean, it just seems so obvious to us now, that diabetes is, what is diabetes? A disease of carbohydrate intolerance. So how do you treat it? Well, you reduce carbohydrates. As my kids would say, duh. I mean, it's pretty bleeding obvious. And yet, there's this sort of blind spot in the medical profession and the dietetics profession, where they became so obsessed with fat and the avoidance of fat that they prioritized that over, what was staring them in the face. I mean, 100 years ago, we knew that, avoiding carbohydrates was the secret of managing diabetes, even type 1 diabetes before insulin came along. I mean, we knew that. And yet somehow, it's hard to see how it happens. Somehow we just lost the plot for 50 years and just got obsessed with this fat thing and started recommending, a low-fat, high-carbohydrate diet to people with type 2 diabetes, a disease of carbohydrate intolerance. I mean, it's just, when you think about it, it's probably the craziest decision ever been made in medicine.
So how does that, can I ask you guys are both older than me and both wiser. So how do public officials, medical organizations, and public health experts say that this is the best way to go, and what needs to happen for that to be the message that's heard for 50 years? And we still struggle with the legacy of that, right? You and I are making our own apps to try to help people because they lack the information we need to get to them. So can you help me understand, how does that happen?
Yeah, that's a good question. Really tough. I mean, I'll let Brian have a crack at it, but it's people unfortunately have ignored the science, and as I said before, it's more sort of money and politics, and obviously there's a lot of and once an idea gets into people's head and so on, then of course the whole industry develops around it, and it becomes a huge financial thing. I mean, the food industry and the pharmaceutical industry have made a fortune out of the low carb, the whole cholesterol sort of deal. So they're very reluctant to change, because obviously that suits them very well. So there's a lot of people who've benefited from the mistakes that have been made along the way, and it's very hard to get people to change once things are entrenched. It's very hard to change. The medical profession is very conservative. They're very reluctant to change. And they're also, it's very difficult if you've been pushing a particular line to your patients and to students and so on for the last 30 or 40 years that cholesterol is the problem and that low fat is the answer and all that sort of stuff. It's very hard when some clown like Noakes or Bruckner or comes along and says, no, you're wrong. Of course they're going to say, go away. That's rubbish. What would you know? You're not diabetes specialist. You're not nutritionist, etc. So there's a lot of pushback against that. People are very reluctant to change and admit they're wrong and so on. So I can see why it's so difficult to change, but that's the challenge we have in front of us. Brian, you got any thoughts on that?
Yeah, I would say the same. I was thinking the same thing, and I was thinking you must be smarter than some other people, or luckier, because you were coming out saying the same thing, and you weren't on trial for 3 years. You didn't. I don't know. I haven't heard that. I'm sure you got a lot of blowback and kick. As I did from my colleagues when I started. They go, Brian, you're a respected guy. Why are you talking about this crazy stuff? But I was like, look at my patients. I had 11 patients come off insulin in 6 months. I had never seen that before. I heard chiropractors talking about it. I go, these people are nuts talking about getting people off insulin. And then once you have it, you go, wow, this is amazing. And then I see people like you and Noakes and Fetke and people say, look, I was wrong. If someone says I was wrong and they change course, unless they're saying, oh, I was wrong, but here I'm selling this product, right? All of a sudden, then you say, well, did they change because they're selling this product? And when you see people say, yeah, we were wrong, we looked at more evidence and we were wrong, we're going to change what we're doing. And how can you not respect that? Right? Instead of attacking, you say, well, why are you changing? If I see someone who's one religion, then all of a sudden become a new religion, I'll say, well, what was so great? How did this happen? Like, well, tell me about it. What was the life change? And so we're always really interested in that. So that I think that's part of it. I think a big part of it is arrogance, that you're not willing to say, I've been wrong for 10 years. Now managing thyroid, I've learned a lot in the last 6 months to a year. I go, I mismanaged it for 18 years. Now I'm starting to figure out, what are you going to say?
Yeah.
Keep doing what you're doing because you've done it that way. And medicine is that way, where there's stuff I was told by an endocrinologist, only TSH matters, nothing else matters, right? It's all waste of time. And these people are just, and then when you realize, well, these patients, are they lying when they say they feel terrible on certain medicines? I switch and they feel great. All of a sudden, are they like psychotic, right? So these kind of things I think it's the arrogance. And in medicine, everything gets handed down, and people like Trobe, little whippersnappers like Trobe, come along and say, where's the data that shows that works? Well, because my guy told me, and this person, it just gets handed down like an oral tradition, and no one ever challenges it.
Yeah, it's absolutely true. I mean, there's a great saying that says that 50% of everything we get taught in medical school turns out to be wrong. We just have to work out which 50%. But the majority of doctors still believe 100% of the things they were taught in medical school, and still are reluctant to change. So we've got to become much better at that. And it's funny. I mean, there's certainly a lot of pushback against this. It's fun. People say, well, you can't concentrate on just one nutrient, carbohydrates. And I said, well, hang on, you've been concentrating on one nutrient for 40 years, and that's bad, but we can't concentrate on carbohydrate and they say there's all this evidence, and you go back there and most of what evidence there is fraudulent and corrupt. And when you actually look at the evidence, there just is no evidence, and yet. We're supposed to be, in this era of evidence-based medicine. We hear that all the time, don't we? Oh, evidence-based medicine, that's what we've got to be. And yet there is no evidence for what they've been doing.
And you look back at, and it was the same people. They were all referring to other people's, their own studies of friends of theirs, right? So you go, yeah, Trobe agrees with me. Dr. Bruckner agrees with me. Then you go, look, it's got to be the science. Instead of saying, there's like other people who don't agree with what you're saying, and here's why. But I think, what I see, and for your experience, I think one of the things that has concerned me the most in the last 2 years has been the inability for us to question the dogma, to say, hey, wait, here's what's happening in my practice. Here's my numbers. Let's compare to yours. Let's talk about that. Like grand rounds where one doctor thought, taking out both ovaries was a huge problem. The other one said, keep one ovary and they're going to do better. Like, let's talk about that. Let's talk about it and say, hey, let's have open discussion. Let's see your data and show me yours. Like the great thing that Fetke and Noakes did was not just walk off into the sunset and say, okay, I'll just retire and keep this to myself. They fought the system and they said, here's my evidence. Where's your evidence that I'm wrong?
Absolutely, yeah. And enormous admiration for both of those men. To put up with. I mean, I know them both very well, and I know what they had to go through for those 2 or 3 years when they were being hammered by the medical authorities who really should have known better. It was very disappointing to see the way they were treated, but ultimately they were vindicated. But even having been vindicated, you think, okay, now they've been vindicated, everything will change, and still nothing changes. It's still, people are so reluctant to change their thoughts on these things, and we've got to be honest about the enormous influence that the pharmaceutical and food industries have on thinking, on politics, and on government, and even on the medical profession. So it's a really tough battle, but ultimately it'll succeed. As many people have done, there's a lot of parallels with the tobacco story. They say sugar is the new tobacco, and it took 30 or 40 years before people finally acknowledged that tobacco was detrimental to health, and yet the evidence had been there for some time, and industry had managed to bury that evidence for decades, and there's very similar things happening in the world now, and we have to shout from the rooftops that to counteract what industry and money is doing, and we do it through our patients. We see, we get feedback, as you've just said. You have people come off insulin. You have people, reversing their diabetes. We get an email every couple of days from saying, thank you, you've changed my life. That's, no one ever said that to me when I fixed their ankle or their knee. Jesus, it's very powerful when you get that feedback from patients, and and not just diabetes as well. There's such a range of chronic medical conditions that are improved by dietary change. From obviously epilepsy we've known about for 100 years, but that's an amazing story. We knew that a ketogenic diet is very advantageous for epilepsy. We've known that for 100 years, and yet no one in that 100 years has ever sort of sat down and thought, well, hang on a minute, if it works for epilepsy, maybe it works for some other neurological conditions as well. Maybe we should look into it. But no, people have just ignored that and said, oh yeah, it works for epilepsy, move on. And yet, we know that things like, Parkinson's disease and multiple sclerosis and mental health issues, anxiety, depression. This type of dietary change is enormously beneficial, and yet why hasn't anyone sort of thought of that for the last 100 years? It's just unfortunately in medicine, we don't question things enough. We just accept things too much, and it's funny. You become a real, once you realize, and you read what's going on in this whole sugar world and low carb world and low fat world. You become a bit of a cynic and a skeptic. You start questioning everything, and it's interesting that so many of the low carb people have become sort of passionate vaccine hesitant people in the last couple of years, and I think it's because of that experience of being disillusioned with medicine and realizing that things are not quite the way they appear to be sometimes. So it's been a fascinating sort of journey of the last for me anyway, the last 10 years, and looking at all these different aspects. But it just blows me away, the impact that diet has on such a range of conditions, and even in sports, medicine. I'm marrying my two interests, of sport and nutrition. It first became obvious to me. I used to look after the Australian cricket team. It's that funny, sport the English, inflicted on all the colonies except for you guys, and we were traveling. We were in India, traveling with it. And the Australian cricket team is the biggest team in the country. Like that's our, it's our national sport, and everyone, everyone follows it and so on. And I was away. We were away in India, and it was just after I'd lost all my weight. And one of the guys, was a little bit overweight, and he came up to me and said, I like to, like to lose some weight. I'd like to do what you did. It was very effective and so on. But he had an interesting story. He'd had knee pain for 2 or 3 years, to the point where he'd had to stop playing cricket. And he'd been to see every specialist, and he'd had MRIs, he'd had arthroscopies, he'd had all sorts of things, and no one could work out what was wrong with him. Finally, he saw a very clever rheumatologist who said, "No, you've got a seronegative arthritis." Which is, a type of similar to rheumatoid arthritis, but a little bit different, and put him on some pretty heavy duty medication. Initially, prednisolone and methotrexate, and then onto one of the fancy, tumor necrosis factor inhibitors that are incredibly expensive and so on. And that all improved him to a certain degree, but he still had sort of some knee pain. And when I met him, he was injecting himself with one of these fancy new autoimmune drugs fortnightly. And he said at about day 10 of the fortnight, his knee would start to ache, and he knew it was time for his fortnightly injection. And he was back playing cricket, but he couldn't train fully, and I think the coaches thought he was lazy, and so he wasn't. He was on the sort of on the verge of the team, but not really in the team. Anyway, so he had a crack at low carb, and the good thing about athletes is they're pretty self-disciplined. So he was very good. Not the easiest place to do low carb in India, with all the rice and the naan and all those sort of things. But anyway, he was very good, and stuck to his diet. And 2 or 3 weeks later, he came up. 3 weeks later, he came up to me and said, "Doc, I forgot to have my injection last week." I said, "Well, what do you mean?" He said, "Well, I didn't have any pain, and I just sort of forgot about it. Do you think I should have the injection now?" And I pretended that I'd actually expected that, and I wasn't surprised at all. But I said, no, why don't you wait and see? Anyway, to cut a long story short, he did not require any more injections, so he saved himself $15,000 a year, I think was what the injections were costing. And he was able to, he had no more knee pain. He was able to increase his training. And within 12 months, he was ranked in the top 10 batsmen in the world, and has continued on that way ever since. And that, and I had no idea that was going to happen, to be honest. It completely blew me away. And that just, was a real eye-opening experience for me, realizing the effect that it can have on inflammation. And as we know, inflammation is the basis of pretty much all chronic disease, from even cardiovascular disease, even mental health now is thought to be significantly related to inflammation, and then has such a dramatic effect on inflammation. So it was sort of, it was good in that it gave me an understanding of why this thing works so well. And now actually I have a university professorship, and we're diving into. We're looking at the effect of anti-inflammatory diets on osteoarthritis and other and Achilles tendinopathy and all sorts of different things. So yeah, it's a fascinating world.
You're opening so many doors. Many doors. And the first time I saw that too, I was so excited. One of my patients, I was trying to get her cleared for surgery. I told her I couldn't clear unless we got her sugars under control, obese, diabetic, hypertension, every risk factor, and she was miserable. And so I said, look, we've been talking about this for a long time. If you just cut your tortillas and rice and bread and pasta, let's just do it for, 6 weeks. If we get your A1C close to 7, I'll clear you for surgery. She comes in, she dropped it to 6. And I was like, and her blood pressure normalized. We took her off her blood pressure meds. She's feeling great. And I said, okay, you're cleared for surgery. I was going to send her in. And she said, wait a minute. I said, what? She said, my knee doesn't hurt anymore. What should I do? Right. And I couldn't believe it. So I pick up the phone and called Ben Bickman from BYU. And I go, Ben, you're not going to believe this. I got a great story. So this lady lost weight. And look what happened. He said, Brian, you should have expected that. That happens all the time. I'm like, okay, it's not that big of a deal anymore. But it's so great to hear that from your perspective too, because it's shocking when you see that stuff.
Oh, well, not shocking, right? We have interventional trial data actually out of Australia. The group, basically the same research team did a study on chronic pain. And then
Rowena Field in Sydney.
Yeah, exactly. We're going to have her on in a couple months. And then, we have, by the way, see, I'm working, Brian, to get, pretty good.
All right, good. Yeah. I'm pretty impressed today, Troy. You came through. I can't believe I'm it must be someone with a similar name. It can't be him.
Yeah. So they've shown that osteoarthritis and chronic pain both preferentially respond to a low carbohydrate diet. How? Probably exactly what you're talking about. And we've seen markers of interleukin-6 and TNF-alpha preferentially decreased. So there's something else going on, maybe not in everybody, but certainly it's reproducible in a clinical study. But I want to come back to something because I think you mentioned something important. When I asked you why did we ignore this, or how did it get ignored? You mentioned, well, look, there's an industry influence, tobacco, pharma, et cetera. And I thought to myself, well, we have more docs now than we ever had. And we have the internet, and we have Sci-Hub, and we have PubMed, and we have all these resources to elucidate truth, and we have all these resources to actually come together and mobilize and evangelize. And then I thought about this, and I thought about two things. One, when I was training, when I was a medical school student 15 years ago or so on, I remember in my radiology rotation, the radiologist called an X-ray a wet read. And I asked him, why do you call it a wet read? I just didn't know at the time, what is this wet read you're talking about, right? And what he's referring to, just for the listeners, is, when you get an early read of an X-ray. But by the time I was in med school, X-rays were digital for years, okay? And yet we still called it a wet read. And I thought to myself, there's no industry there making doctors call it a wet read. There's no pharmaceutical company making that doctor and the culture there call it a wet read. And there's no industry, even though I certainly believe that all of those are bad actors, right? But there was nobody there but our own legacy, our own ignorance to change, our own unwillingness to rethink about how the culture of medicine to some extent. And then I thought about the smartest doctors I've ever trained with, and I thought, when I first saw this unwillingness to change, and I thought, this is the problem with medicine. We're all ostriches. We're all narrow-minded. We're not open-minded, right? And we're all unwilling to change. And I said, look at these doctors, when a new drug comes out, none of them even use it. Right. And that was my thinking back then. I was like, these docs, they're these wise docs that I thought would be wise. Right. And really, they're just so resistant to change. And the mantra on all of my mentors, the people who taught me, they said, look, when a new drug comes out, just watch and wait, and don't be so quick to take something up. Right. And don't be so quick to change. Right? Because, hey, there's going to be some post-marketing issue that comes up, and all the wise doctors acted this way. And I was struck because I saw the ignorance, so to speak, and unwillingness to change. And yet the wisest people I knew said, hey, just take everything slowly, evaluate things, watch, wait. So help me understand, what's the problem in medicine? How did we miss it? How do we continue to miss it? Is it that we're ignorant? Or is it we're unwilling to change? Should we be unwilling to change? Should we be critical? Like you said, we're all low carb, vaccine hesitant, the low carbers, Should we be examining the data better and be more willing to change more quickly? Should we be less willing to change? Should we, what's the solution here? Because I don't see a way out. The industry is always going to prey on us. People are always going to try to influence us. And I'm trying to think to myself, how do we train a bunch of doctors to never do the mistakes that we made? Help me.
Doc, I'll let you go first. You can have the first segment. My brain is I got the answer in a second.
Oh, I don't know it. So I'm all ears I want to hear. You guys are the wise ones, man. I wish we had Paul here, and that would have been an equal type of scenario. But tell me, what am I like? Is my off? my young and amateurish and sophomoric thoughts, like, where am I off here?
Yeah, look, I mean, you're absolutely right, and that there is a reluctance. I mean, the interesting thing is that the best educators for doctors we have are patients, and patients are the ones who are educating doctors about low carb. It's very interesting. I mean, they excuse me. You see a patient and you diagnose them with type 2 diabetes, and you give them a prescription for whatever drug you like, and they go away and they come back 3 months later and their HbA1c is fantastic, and they're no longer diabetic, and the doctor says, oh, that medication's worked really well, and the patient says, no, I threw the prescription in the trash can, and I went low carb, and look what's happened. And the doctor changes the subject and moves on to their their blood pressure or something like that. But I mean, I think that's going to be the best way we have, because ultimately patients are the best advocates for this for change. They're not going to listen to people like Brian and me, most doctors, because we're weirdos and we've got these weird ideas, and we're not in the sort of usual traditional conservative medical circles. But I think patients are our big chance. They're the ones who are going to convince doctors in the end, because ultimately you can't ignore what you see in front of you. You can't ignore blood results. You can't ignore people coming in and seeing how fantastic they feel and how much weight they've lost and things like that.
Yeah, and my answer to that would be, the reason we're hesitant, like, kids are not afraid of the stove initially, and then you touch the stove once and now they're afraid of the stove, right? Because they realize what happened. So if I give you the short list, I could mention some names that you both will know: Baycol, right? Belvique, Bextra, Silerts.
Oh yeah,
Darvon,
right heart caths,
right? But all the DES, all these things that they said, these are the miracle drugs that are going to save lives, and they killed people. And they were all FDA approved. They all got removed subsequently, right? So, but all these drugs that we knew were going to save lives, and then you say, oh, like Chantix just got yanked, right? So when you see it, you go, okay, I'm going to wait a little bit. My patients are not going to be the guinea pigs, right? And I want to see the data, and I want to see clinical experience. And if something's not working, you say, I'm not using that anymore. If my patients go low carb and their sugars get worse, I go, okay, I'm not doing this. I'm going to do something different.
How do you stay vigilant, Brian? So, like, if you have that approach,
trust but verify. Trust but verify.
Young like me comes and says low carb works. Like, I say it all the time. And then you like, trust. You're crazy, and I'm like, no, I'm publishing the data for you. Like, here you go. They're like, no, you're still crazy, like.
It's the same thing. It's the same thing. It is what we've learned over the years is, if someone, you see an actor gets accused of sexual assault and you go, oh, I don't think so. They seem like a decent person. Then there's another, and then another. Then there's like 20 people. You think, oh my gosh, it has to be true, because how could 20 people be saying the same thing? So when you have all the experts saying the same thing and you say, well, that's not what my clinical experience is showing me, then you have to trust yourself at some point and say, I think I have enough clinical experience and gray hairs to say, I know when something's working and when it's not, right? So I know, like, we know, the patients know. I've had patients do a generic drug and they say, doctor, this drug doesn't work. I don't feel the same. I don't like the blue one. If I'm on the pink one, I feel great, right? We've all seen that. It's like, is it the coloring it's in it? No, it's because we know from what was it called, Trobe? The
Catherine Ebon,
the bag of lies, or
bottle of lies.
The bottle of lies, and you realize, you say, maybe there was a difference. Maybe I should have listened. When statins came out and patients were coming in with muscle aches, they said, no, that's in your head. It can't be, because that's not described, right? We didn't have that. So they're like, it's not from the drug. So that's why we're predisposed to seeing what we've been told. But when we see it, and then you have 4 patients say the same thing, you go, okay, do we have a shared psychosis here, or is this a problem, right? Then you have to start seeing what you're seeing clinically. And that's why people like Dr. Unwin, and all these great docs they've been around and they've seen it, and they say, okay, here's what works and here's what doesn't. And when it's not working, you want to quit your job and you hate it. And when it starts working, we all have joy in what we do. I think Dr. Bruckner's still around doing his thing. He didn't retire and say, forget it, I'm done with this stuff.
I think if you want to, Dr. Bruckner, I'm going to turn it back to you, because I think it's what you're doing. Evangelizing doctors. So getting people like Paul Mason to come in and work together, right? Getting the dietitian, the behavioral specialist, and then reaching people, which is exactly what you're doing. I think the answer is exactly what you guys are both saying, and what you're doing, Dr. Bruckner, which is We have to bring the information to the people and show them with data that we have an impact, right? Which is exactly what you've done. So I think the answer is you. That's what I think. So tell me, am I crazy?
No, you're absolutely right. I mean, we've all got to refer back to the science, and the science is pretty clear. So, we've got the science on our side, and eventually, that science will become, overwhelming, and people will come on board. But it's going to take time. I'm encouraged by the fact that there are a lot of young doctors now who are changing the way they think and are open to new ideas. And
Brian, that's not you.
no, but no, not us. That's for sure. But that next generation, I mean, they seem to be a lot more interested in sort of lifestyle, issues, exercise and diet and so on. That's so much more important. Many of them still, feel as though they can't, talk about it or but they're practicing it themselves and their families and their friends and things. And eventually, they'll become senior enough to have some influence and so on. So I'm sort of optimistic in that regard. And as I said before, I keep going back to the tobacco experience, and that ultimately, that the truth wins out, and people will realize that, that sugar is just as evil as tobacco, and where that it'll become, similarly taxed and warnings and health warnings and all these sort of things, which is what needs to happen. But we're not quite there yet, and we need to keep people like yourselves and we keep pushing the ideas out there, and the great thing is, as you've got, on your website, you've got the science there. There's science there to back up everything. We make the claim on our app that everything we say there is evidence based. We can provide evidence for every single thing, and we've already had people challenge us. As you'd expect. The dietitians and others have written to boards and all sorts of things challenging us, and we've been able to just refer back to the science. And the board's thrown out every challenge that's come to us because we've been able to provide the evidence.
Do you mind Brian? I hope you have a little more time, and can you talk a little bit about that? Because I don't think people appreciate how hard it is to do what you've done. Can you talk about that?
Well, there are always people who are going to oppose you, and whether that's just out of their own belief or vested interest. We had one dietitian who was particularly aggressive about complaining to different organisations that Paul and I were part of, and the medical boards and the registration boards and so on. And I remember saying to Paul, I said, we've got to find out who's behind this person. And it turns out that they were that advocate for the food industry, and although they appeared to be quite independent, but you dive back into their history, and clearly they were being funded by the food industry to make complaints and so on. So, I mean, I don't mind that. I almost take that as a compliment. We're obviously we're important enough for them to actually bother about complaining. But again, I feel comfortable that it's a nuisance and it's stressful and it's very annoying when you have to justify what you're doing. But if we're able to do that, and literally, we responded to the couple of different instances where we've been attacked, and literally within 24 hours, both the organisations got back to us and said, no, absolutely, there's clear evidence for what you're doing. We'll throw out the complaint. So. That's relatively minor compared to what Gary and Tim had to put up with, but it's the sort of thing that we're getting all the time. And,
But you've cultivated that strength to be able to handle that, right? So that's also key. Like what you're up against, right? Your eyes are open. You saw what Fetke did. Me and Brian are on high guard. We know what's coming to us. We've known for a long time. They've called for every week. I see it on social media. Requests to have my license taken away. I'm a published author, two board certifications. I've done nothing but devote myself to medicine, and yet this is what happens. Right?
Well, yeah, and part of it is look back at LowCarbMD. Like when I look back on the, you see stuff on Twitter and you go, that didn't age well, but we have a lot of stuff that aged very well. Right now, when we were saying, hey, this is what we're seeing, people seem to be happier. Are you seeing that? Right? Addiction's getting better, all this stuff. And then people say we're crazy for even thinking that. I mean, I don't know, maybe it was just coincidence that all my patients' knees don't hurt anymore, that they're happier at home, that their marriages are getting better, their sex life is improved. But I'm seeing it. I can't tell you. I can't lie of what I'm seeing. And so, that's what the problem. I think, honestly, I love having both of you here talking about this. And this is why, I say, Turo, tone it down, because here's the reality is this. There's a doctor in Texas who stood up to the system, and she has really helped a lot of patients with different approach. And she's had 4 reports to the medical board, not one from a patient, all anonymous. She has to get an attorney and she has to go through all this stuff. I mean, there's something wrong with this system. And they say, why doesn't doctor not stand up for what's right? Here's why. Trust me, I was there. $300,000 in medical school loans. You're working for a big corporate entity. You speak out and you are done. And you lose your career, you lose your reputation, you lose your medical license. And now you got to get an attorney and you got to fight the medical board. And it is a disaster, especially if you're right. But someone said on Twitter, I don't know who to, I tried to give it to David Diamond, but I'm not sure who said it, but they said, it's not being wrong that's a problem. It's being right too early, right? That's what Dr. Fetke and Dr. Noakes paid for, because they were right too early. Let someone else be right first and then let them take the arrows, right? That's what happened.
And look, we've people like Dr. Fecchi and Dr. Noakes and myself. We're at the end of our careers. We've done what we wanted to do, and so they can take our license thing away from us and all that sort of stuff. I mean, it doesn't matter to us. We're happy with what we've done. For young doctors, I can completely understand why they don't speak out about this sort of a thing, because they'll get hammered, and they've got a mortgage to pay and family to look after and a career to worry about, and so on. So, I think that's the very sad thing, that people feel as though they can't speak out about the science. As I said, I mean, I keep coming back to this. The science shows that we're right. I mean, there's so much evidence, but that evidence has been buried, very cleverly by the people who want to maintain the status quo. And it's our job, is to get that evidence in front of people and so on. So I understand why, young docs who might be sympathetic, who are reluctant to speak out. Certainly, as you found, Tro, it can be pretty painful.
Yeah. I think the other thing is I think we have to explore other ways of organizing and other ways of reaching patients. This is one of the reasons why we set up the Society of Metabolic Health Practitioners, which both me and Brian are a part of. We need to organize, which Mark Cucuzella and Eric Westman are on the board with Dr. Sivas as well, and Doug Reynolds. And what we're trying to do is organize physicians so we can reach more people. And then the second thing we need to do is exactly what you're doing. And I wish I met you like 2 years ago, 3 years ago. I would have licensed your app. I wouldn't have made one. I would have said, well, let's figure out a way to work together. But I think what you're doing is like, look, we need to bring this info straight to the people. And I think that's going to be very critical too.
And it's a huge cost. And, for me, I'm using Restore in my practice, right? Because I said, guys, here's what I need. I need this. You guys make it happen, right? I'm a doc. I want to take care of patients. So having that, but we all are seeing, hey, if I really want to help a lot of people, we're the limiting factor. Like, we can only see so many people in a day. So if you say, hey, see me once a month or once every 2, whatever we work out, and then use this other stuff and, have a health coach, have other people do some of the heavy lifting, and then have the community and have people around. And we all see the same thing. We need to support our patients. We need to have continuity of care. We need to have, some monitoring, whether it's scales or continuous glucose monitors or just checking in with your coach. Because again, the great thing about us is that we all have clinical experience. We've seen it. There's people who have all the education in the world and they flail. And we have people who have, all the motivation at the beginning, then they go home and they go through a divorce and they're going through stuff. So we realize, these guys who say, well, it's calories in, calories out. We put a mouse in a cage and this is what happens. Well, the mouse isn't going through a divorce. The mouse doesn't have to pay their mortgage. The mouse doesn't have tension and pressure and all these other stuff and dealing with worrying about the world ending. They don't really care about that stuff, but we do. Right. So it has an impact, all this stuff. And knowing you're part of a community and you're not the only one who's not eating cookies tonight, right, in the world. It's a huge thing that we're all doing. We all seen the same problem, and we all found the same solution to that problem, which is kind of cool.
Yeah, it's interesting, isn't it, that so many people have come to the same conclusion, and from so many different directions and different areas and so on. And yeah, so there's got to be something in it. But full kudos to you guys, for doing the podcast and doing everything that you're doing. I mean, I think it's fantastic, and I love the podcast, and yeah, I'm very honored to be a guest. I can assure you.
No, we're honored to have you, and honestly, we're honored to have you and the work you've done and the lectures you've done, and
yeah, we figured you must have better something to come on.
No,
it's good to have you. It's an honor. Really, it is an honor to have you on.
Really, I think the most admirable quality is that he found a way to work with a young, crazy doctor. And I think that's his most admirable.
But like Tro, I'll tell you, that there's truth to that. You need the young, brash guy who's going to go out and get in people's face. You need someone who goes, look, this is the fight we're going to fight. This is the one we're not going to fight. Because the more we're around, the more we realize, right? And I realize my role is not to be Tro. My role is not to be the guy who's going to do the front edge research. But look at that. I'm very proud of what you've accomplished, right? Even being brash and yelling at people and doing stuff that, right, I wouldn't do, but you're doing it and it's working, and you're successful and you're helping a ton of people. And a lot of people, when I'm at you were too wimpy to be at the conference, but I'm there. People say, wow, Tro saved my life. Tro really helped me. Tro did this. And all these people that ridicule you, I haven't heard any of those people mentioned yet by any of these people saying, wow, this person saved my life. I hear people saying Jason Fung saved their life, Dr. Fetke, Dr. Noakes, Dr. Bruckner, these people who've been out there like doing what they do. And so it's amazing. It's just amazing. But we need both characters. We need people who are brashing out there with the gunslingers, and someone else who says, okay, let's pick our battles, and let's not engage with people who are just gonna they're not gonna change what they're doing. You can't help that person. I think there's a wisdom that comes with time too, and gray hairs and all this kind of good stuff, and Matlock. Right, Trobe?
Here's the thing, guys. Check out Defeat Diabetes, the app. Okay, defeatdiabetes.com/.au. And this is Dr. Peter Bruckner. We're so happy to have you. Any parting words? How do people find you? How do people get you if they wanted to contact you, or anything else that they should know?
Yeah, they can go to Defeat Diabetes website and contact me, or a Fat Lot of Good website, and but I'm sure you could, if they contact you, you can pass them on to me as well. So that'd be great. So
perfect. All right. I don't think we have any questions today, but let's take a look.
While we wait for a question, I have a question for you. What over your career do you look back, and what's a really important lesson you learned along the way that you would pass along to a new doc coming out of college, or coming out of med school?
Yeah, well, I think don't accept everything that that you're taught in medical school for the rest of your life. Constantly ask questions, and don't assume that things that have been the case for 20, 30, 40 years aren't necessarily the case. I feel as though I wasted sort of 30 years of my medical degree before I discovered the importance of nutrition and so on. And I would hope that new graduates don't have that same experience, and so realize that nutrition and exercise and things like that are just as important, if not more so, than drugs and surgery.
Yeah, amen.
Amen to that, for sure.
Dr. Bruckner, thank you so much. Brian, it's always such a pleasure. We got to do this more often. And guys, Patreon supporters, we really appreciate you guys donating. This is a podcast without commercials, brought to you by you. We're able to bring amazing guests. We are not for profit, and you keep us that way. So thank you so much.
And thank you. And I get to check one more check off my bucket list. What an honor having you. Honestly, it's great. And thank you for opening the doors, standing the tide. I don't think you get enough credit for what you've done. I think Fetke and Noakes have been the forefront, and so it's always been noticed, like, that you're a voice of reason out there, and that you've been pushing the cart forward, and I'm so happy with all you're doing. I wasn't aware of some of this that you're doing, so it's awesome stuff.
Oh, thank you, and thank you for having me. You guys are doing a great job, and we'll all work together, and we'll get there in the end. And hopefully, I'll look forward to catching up with you guys, maybe in Denver next year. I think they're going to have another conference there then. So I'll come over. It'll be terrific to see you.
Well, I don't know. I hope so. The last I talked to, I got to talk to Jeff again, but He was a little iffy on it, but we may pick up the mantle in New York. So we'll see.
Oh,
We'll
that'd be
definitely
great.
invite you then. All right. Thank you so much.
Sounds great.
All right,
Okay,
and then,
thanks,
and then
guys.
we'll talk offline about this stuff. You told me how I could tone Tro down, right? We'll talk about that
Yeah.
offline.
All right. Okay.
All right.
Thanks.